Good afternoon. Good afternoon. Welcome to the Columbus Metropolitan Club. This is CMC's 49th year of community conversations, and that deserves a round of applause. I'm Susan Merriman, Vice President of Marketing and Communications for OhioHealth, and I'm also proud to serve on the Columbus Metropolitan Club's Board of Trustees. For those of you joining by live stream, we're coming to you from the View in the Brewery District. If you scan the QR codes at your tables, you can learn more about today's forum, take a short survey, and see the many organizations that support your non-for-profit Columbus Metropolitan Club. Thank you so much to the presenting sponsors of CMC's ongoing Optimal Health Series, The Ohio State University, Wexner Medical Center, OhioHealth, and Nationwide Children's Hospital. We're also grateful to the sponsors of today's forum, AstraZeneca, Carmel Health, Fifth Third Bank, the Healthcare Career Collaborative of Central Ohio, powered by Aspire, Mount Carmel Health System, and CK Construction. We also want to thank the presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation, and our live stream partner, the Columbus Dispatch, and our host, View Columbus. Yes, every CMC forum takes a village. Let's give a round of applause for them. Central Ohio is growing rapidly, and the region's 4 major hospital systems are following suit. Each of Columbus's big 4 systems are expanding, constructing new facilities, and working tirelessly to fill all the qualified healthcare positions that are needed. Now, the question for today is, can Central Ohio's biggest healthcare players keep pace with the demand? Today, we welcome an extraordinary panel featuring the CEOs of all 4 of our region's major hospital systems as we explore the present and the future of healthcare in Central Ohio. Please help me welcome today's distinguished panelists, Dr. Stephen Markovich, President and CEO of OhioHealth, Tawana McDonald, President and CEO of the Mount Carmel Health System, Tim Robertson, CEO of Nationwide Children's Hospital, Dr. John Warner, CEO of the OSU Wexner Medical Center and Executive Vice President at The Ohio State University, and our host, Greg Moody, Director of Professional Development and the State of Ohio Leadership Institute at OSU's John Glenn College for Public Affairs.
Thank you. Good afternoon, everyone. Today we gathered to discuss the future of healthcare in Central Ohio, a topic that touches each of us deeply. Regardless of our backgrounds, we all share a vulnerability when it comes to our health. It's in these moments of need that the humanity of our healthcare providers shine the brightest. Let's get right into our conversation with our panel of hospital CEOs who are here to share their insights and commitment to our community's well-being. Your systems have long partnered with our local health departments to identify and address unmet health needs. That work will be updated this spring in the Franklin County Health Map 2025. What local health priorities do you anticipate will be highlighted, and how will you address these priorities?
There's a number of, I'm Steve Markovich, pleasure to be here. There's a number of priorities that we've seen a draft of the work. Behavioral health is continuing to be a challenge for our community. Uniform access to care is a big challenge, making sure people can get to the providers that they need in their local community as opposed to perhaps being too distant. So what we call social determinants of health, things that may not be directly created by health, but they drive health outcomes. So you think about transportation insecurity, food insecurity, housing insecurity. I already mentioned access. There's a ton of issues out there that in the end have outcomes on healthcare. And that ultimately drives your well-being, your prosperity, and your ability to achieve and fulfill your life's goals. I'll take behavioral health as one example. We came together, Franklin County through the ADAM board is working to help make sure we've got critical access sites for behavioral health issues that are acute, people that are in crisis. There was a system that was old, it was underfunded, and it was small. And we've provided the seed money to create the new Franklin County mental health facility that's going up not too far from here, to give folks an access place for when they're in crisis. So that's just one example of where the systems, we try to come together for issues that sort of cut across all of us. You've got folks that when the police or the fire department have their hands tied and they've got a patient who's in distress, they bring them to the ER. The ER, I think any of us that have been to an emergency department know that if you're having a heart attack or you're a trauma patient, you love the care that our ERs provide, but it may not be the best place for a behavioral health patient to receive care, and certainly they can't provide long-term or definitive care. So to have facilities like the Franklin County crisis facility is going to be a great asset to the community when it opens.
Yeah, and I might even add to that a bit as the relative newcomer to Ohio. I'm John Warner. I've been here for about 21 months. I want to thank the people of Ohio for giving me one warm-up winter before this one. So I now own the heaviest coat I've ever bought in my entire life. And so, but it really is a unique partnership that the four of us have really around so many things that you'll hear about over the next hour, but in particular around behavioral and mental health. This is a transformative time. The mental health stress for our nation, for our state, for our community is significant. Just to put a number to Steve's initial comments, about 70 people each day in Columbus have a mental health crisis, and 3 out of 4 of those people typically seek care in our emergency departments, which is sometimes overwhelming to all of us. So coming together, as Steve mentioned, to create the crisis center and work collaboratively to really help address these needs, and working in partnership with ADAMH and so many other like-minded institutions is really something pretty unique. As a relative newcomer to this environment, this partnership, this collaboration, this prioritization of mental health resources and the effort that goes into that is really, I think, transformative. It's on all of our minds. It is a crisis not only here in Central Ohio, but across the state of Ohio and across our nation. And so thinking collaboratively and together to pool our resources to really work for the health and well-being in that mental health space, I think is really important.
Tim Robinson, I just want to know who's running the hospitals as I look around the room here. Another big area that we've been really after for a long, long time is infant mortality. It's something that we came together as a group through the Ohio Better Birth Outcomes Initiative, working with the city and county health departments to really tackle this really persistent issue. It's a national issue, it's a statewide issue, and it's an issue here in Central Ohio. And we started to make some really good progress, and then we hit the pandemic, slid back a little bit. Now I think we're back at it and making some great efforts there. The disparity is really still the major challenge, where a Black baby has a 3 times higher probability of dying than a white baby. And so that's where we're focused: prenatal care, safe sleep, really home visitation for really at-risk moms. And so we're all coming together as a community with Celebrate One to try and address that, and something that we're going to continue to focus on.
And then I'll share more about what Steve started with and talking about the social determinants of health. One of the things that we're all aware of is that affordable housing is really critical to health, and that affordable housing is challenging, not just in Central Ohio. I've been in healthcare for 30 years, and every place that I've been, that has always been an issue. When you have somebody who comes, you are able to treat them in the hospital and help them get well, but then if you discharge them and they don't have a place to go, that's not providing great healthcare. And so we have partnered, so Mount Carmel has partnered with the Community Shelter Board, and it's for the entire city. It's not just a Mount Carmel program. And so what we do is really work to get people who are unhoused. We go out to to the camps. We get referrals from all of the hospitals, from all of the, from the police department, to really try to help people who are unhoused find housing. And so last year, we were able to provide housing for 98 people who were unhoused, and there was a 0% recidivism rate. And so that might not seem like a huge number, but it does matter. And what we do know is that as we continue to grow, we're so excited about Central Ohio because we're growing, but with that, we also, the need for affordable housing grows. And so we need to work hard, and we work together. We all understand that. And so we work together to make sure that we're trying to provide housing or help people find housing.
Thank you. Let's stay on the theme of growth. Central Ohio is experiencing rapid growth. 5 of Ohio's 6 fastest growing counties are here. And Columbus is among the fastest growing cities in the US. And this is something, our population grew faster than any other city in the country in the second half of last year. How do your systems support and how do you contribute to that kind of economic growth?
I can start. One of our big driving missions is to make sure that no child needs to leave Central Ohio to get the best care anywhere in the world. And as a result, we see kids coming from all 88 counties, all 50 states, and 45 foreign countries. And so our goal is to continue to be able to make sure that we've got accessible, high-quality care around our community, regardless of ability to pay. I think the other big area that we've been focused on is our Abigail Wexner Research Institute is one of the largest and fastest growing pediatric research institutes in the country. And so in addition to providing that innovative care that we're translating to the bedside, we're also able to innovate and to be able to spin out companies that's really creating, in partnership with the Ohio State University, with Battelle and others, an ecosystem around biotech that I think is really putting Columbus on the map. So there's a lot going on, and we're committed to making sure that all the kids are served in our community.
And then I'll just share that, when people are looking to move to a new area, they're looking to make sure that there's good health care here, there's good education. And so, we're all committed to growing and making sure that we can provide that health care. And so we, continue to look. We're very excited. Just I guess last week it was Governor DeWine, announced that 4,000 new jobs were coming with Anderville, and so making sure that we are providing health care to all across the Central Ohio, and that people have what they need, and also to grow, you have to have a healthy workforce. So people come here with their families and want to get health care, but they also need a healthy workforce, and so we're all committed to that.
Yeah, you've seen similar strategies from all of us, really, is around kind of spreading out across Central Ohio to make sure that healthcare is offered close to home for people, where it's most convenient and most impactful to their families, to the residents of Central Ohio and their families. The numbers in many ways are somewhat, somewhat overwhelming. And when you think about potentially 1 million people moving here to Central Ohio over the next decade, and a lot of that growth, as Tim mentioned, is companies choosing to come to Central Ohio to be part of this growing environment, this growing economy, and to be part of the state of Ohio. So many of these companies, when you talk to them, one of the reasons they're choosing to come here is healthcare. And so, so we want to work collaboratively together to really make healthcare an asset for this growth. So when people are choosing to come here, they're thinking not only the business opportunity, but also for the ease of use of healthcare. It matters to companies. And so one thing I really appreciate is the way that we all work collaboratively. There's a little competition in every city and every environment, but we really do work together to make sure that we're working to contribute to making that healthcare an asset. So, and again, a lot of what we're doing is putting facilities in communities close to home, close to businesses, so that healthcare is less of a burden. It's easier to get to. The access is good. So I really appreciate the work that we do together as one of the relative newcomers to this environment. This isn't something you see in every urban environment, where sometimes the focus is on competition as opposed to collaboration. There's a little bit of both, obviously, in every environment, but I really think the latter is the priority for us as a group.
So I'm privileged at OhioHealth to lead 35,000 associates. We're one of the largest employers in the region. And if you added up the associates that work at each one of our organizations, it's a big number. So we appreciate we are woven into the economic fabric of the community. Okay, so we've got a lot of jobs, a lot of people, a lot of folks that are getting good paychecks, they have benefits, and we take that very seriously. Today across the United States, or at least in Ohio, about 2/3 of the healthcare systems across the state are losing money. They're operating in the red. In Columbus, we're very fortunate, I think partly because of the economic viability of the region. We're all doing pretty well. And that allows us to invest. We can invest in our people, we can invest in our infrastructure, our resources, technology, research, and that's good for the community. So that when other organizations, as Columbus is growing, other organizations think about Columbus or Central Ohio as a place to put their headquarters or put their building or put their factory. One of the questions they ask is, well, what's the healthcare infrastructure like? And I think we could say it's very stable. It is very high quality. It is very diverse. I mean, we have community resources, we have academic resources, we have children's resources. So you've got a lot of diversity in many, many ways across the healthcare space. And when you think about how the community's economic prosperity happens, we just like having a great education system and having a great transportation system. Those are all the things that need to happen in order to have a bigger prosperity for the community.
Thank you. Yeah, when you look around the country, this is a special situation here where we have more competition in our healthcare marketplace in Central Ohio than most places. And I think you've also heard pretty clearly the benefit of collaboration within that environment. And that's unusual. That's unusual across the country. Those companies coming here, you're also competing with them for workers. Collectively, your systems are directly responsible for about 50,000 jobs. What are the biggest challenges you face in maintaining and growing your workforce? And how are your systems addressing these challenges, both individually and on this theme of collaboration?
I'll start. So, as we've talked about, we're all growing, and there are more jobs than there are workers. And the thing that's different now is that we're not just competing with each other for healthcare in healthcare spaces, but we're competing with Amazon and others. And so a few things that we're doing, I think we actually, as part of the Central Ohio Hospital Council, have put together a workforce committee because we understand the importance of that for all of us and really trying to tackle that. But beyond that, we at Mount Carmel, I'll just talk a little bit about, we have a College of Nursing, so we're trying to build some of our own workforce. So we have a College of Nursing that's been around for many, many years. We're expanding the programs at that college to look more at allied health and some of the other areas of healthcare where there are shortages. We're partnering with schools from a young age to get people interested in healthcare. If you look around, when we think about, for instance, our imaging programs, if there's not enough people coming out every year to fill the jobs that are open today. And so as we're growing, we really have to be focused on that. And then the other thing is, I think we're all focusing on retention. How do we, once we have people within our organizations, not if you hire people in but you don't keep them, you're not really solving your issue, but building a culture where people want to work, and then also creating pathways for people to grow. So we are training people who may come in one space and have an interest in becoming a clinical worker in some space and training people to do that. So lots of opportunities there, but I will say it is a challenge.
Talent is probably the number one issue CEOs think about today in the healthcare space. We're about 1 million nurses short across the United States. I use nursing only as one example. I could say the same thing for rad techs and surge techs and all sorts of folks that we need desperately. We certainly compete in the talent war, and we all try to offer competitive wages and great benefits and development for our people, a culture is what helps you retain people. But we've come together to, for antitrust reasons, we can't talk about those things, but what we do talk about is the depth of the talent pool. How do we grow more people that are either interested in healthcare, or how do we create capacity in the institutions that create healthcare leaders and healthcare associates? How do we invest in mechanisms to create more talent? We've all got programs where we're reaching into the high schools, where we bring people and give them healthcare experiential learning so that they can perhaps get excited about a healthcare career. OhioHealth made a $25 million philanthropic gift to Columbus State. Columbus State graduates about 1,500 healthcare folks every year in various job titles. And David Harrison is a great leader over there. And I said, David, what would it take to double your output? And he said, well, it'd take facilities, it would take instructors, labs, classrooms. And I said, what's it cost? And he said, I would need about $25 million. That is a good use of our piggy bank to make those kind of investments. No strings attached on, if he doubles his workforce, whether they go to Mount Carmel or Ohio State or Children's, we don't care. We just need a bigger pool of talent for the community. It's really, really important because as the community grows, we're going to need more resources to take care of those people.
And I'll piggyback onto that because I'm joined today from two of my colleagues here from our College of Nursing and College of Medicine, Dean Karen Rose and Dean Carol Bradford. This is very much on our minds as well for all the reasons that Stephen and Tawana just said. I mean, we're focused on growing the workforce for the entire Central Ohio and Ohio communities as well. So expansion of our programs is very much on our minds as well. I view this in kind of two venues. One is we have to train more people, and then we have to convince them to stay in Ohio and work with all of us. So expansion of our programs across the College of Nursing, across the College of Medicine, all the different health sciences is critically important to the growth, but also attracting people here. So we won't be able to train enough people, I think, here in Columbus to meet the growing healthcare needs of this very rapidly growing economy. So part of it is building the ecosystem that we're talking about here today, where people are attracted here for either their first, second, third job and being part of this. So that part of it is that culture of collaboration across the healthcare ecosystem. That's critically important. I'm also really thankful for things like the healthcare collaboratives across Columbus. And, we have the Healthcare Resource Collaborative of Central Ohio is here today. I think I saw you guys waving when you were introduced. Yeah, thank you, right in the middle there. But we're very thankful for the work that you do because just as others have said, some of this work begins in middle school and high school and helping people think about healthcare as a career, giving them some sort of experiential learning that you can kind of plant that seed so that they grow into these roles and grow into these jobs. So it's going to take more than just one or two things for us to meet this growing workforce need. It's going to take sort of investment and effort across all that whole continuum to meet the healthcare needs of our businesses.
I think it's all been very well said. We have a lot of appreciation for what you did with Columbus State and creating a pipeline that benefits all of us. Our great partnership, our academic partnership with the Ohio State University, and really, filling our pipeline, working in the communities through our Healthy Neighborhoods, Healthy Families initiative to really bring the community out, workforce development, and on also getting those kids out of school. The Columbus Promise, which is another great partnership with Columbus State that really is feeding that pipeline. For us in pediatrics, pediatricians, pediatric subspecialists, there's a real challenge across the country. And luckily, because of the reputation of the organization, the fact that we have really high quality people that other people want to work with, we've been able to succeed in that environment, but it is very, very challenging.
And it's really easy to automatically think about career fields like nursing or, surgical technology or, rad techs, the people that take your x-ray. There is a physician shortage coming that we're right on the beginning of. This is why, any of you in the audience that, you're referred to a specialist and you're told it's 30, 60, 90 days to get in to see a specialist. We're having a problem with to meet the demands. In the Columbus metro area, the Medicare age population is growing 1% per year. And it is that older generation that is the higher consumers of healthcare, especially specialists. So the role Ohio State plays, the role all of us play in residency programs to train physicians, the role OU plays with their physician program. We're going to need to not just grow talent, but we have to keep it in Central Ohio. To train people here and then have them go practice in Southern California or Texas doesn't help the community. So we've got to make sure we really work hard to keep our people here.
And maybe just to add a stat to that. So it's not just the responsibility that we have, as so many of all of us are essentially tertiary type, systems that really attract patients from all across Ohio. I'll speak with Ohio State. Last year we saw patients from all 88 counties. We saw patients from all 50 states and from 26 countries. So we're a destination as these other systems are as well. So we have a unique obligation to also not just think about Central Ohio, but to think about the state of Ohio as well, because we're up against it as a state too. Because about 1 out of 4 physicians that graduate our medical schools are here in Ohio long term. That's a pretty sobering statistic. So if we're going to meet this, we've got to sort of attract people to Ohio and then give them reasons to stay for all the things that others have mentioned, unique training experience, and also thinking about tailoring the work that we do to make sure we're meeting the health needs of across the state of Ohio. We're very focused at Ohio State on being a better partner to our rural partners across the state, thinking about how we can co-create solutions for their healthcare workforce needs as well. So, you'll hear a lot from Ohio State, both from me and from President Carter, thinking about how we can better partner with health systems, with health like-minded institutions across the state to improve the health and well-being of rural communities and help them co-create solutions for their workforce needs as well.
Thank you. Let's talk about the visible signs that support those efforts. Your hospital systems are undertaking significant construction projects. Cranes are a common sight across the city. What drives the need for these projects, and how do you determine where to expand? How do these projects align with the community's needs and future growth?
I'll start.
Please.
So, and we've talked about the growth in Central Ohio, and one of the things that we know is that people want care close to home. So we all have institutions that have been around for years, but as you look at the population and where the population is moving, people want to be able to get their care close to home. Also, as new technology has developed, new models of care being provided in the outpatient setting. So really looking at the best way to provide that care, and then providing that access in the right spaces. And what we do is we really talk to the community. You look at community need, right? And then we do listening sessions, and when we go out and decide that we think this is a place where more care is needed, where we could provide service to help the community. We do listening sessions, we do data research, we understand what's coming to that community, what care is already there, what the needs are. So it's not just a willy-nilly, it really is trying to make sure that we are looking at the needs of the community and then providing the care so that people are close to home and can get the care that they need.
I do think the growth is driving a lot of it. And each of us has some aging facilities as well. Riverside is up the street, is the biggest hospital in the OhioHealth system. The main chassis of Riverside was opened in 1961. And back in 1961, there was no such thing as a surgical robot or bone marrow transplant units and things like that. So as healthcare has evolved, the needs of the infrastructure changes. And so that's why you see some of the construction. Back in those days, semi-private rooms were common. I doubt there's anyone in the room that would like to have a roommate for their 3 or 4 or 5 days in a hospital. So you've got in some cases, aging infrastructure. In some cases, you've got the generic growth in the community where you need to meet those needs. You asked how we make the decision. We look at the demographics of the community. Where is growth happening? Where are the underserved locations? Tawana mentioned healthcare is becoming more ambulatory. Things sometimes start 20, 30, 50 years ago. It could only happen in a hospital, and today it can happen in your home. We do care at home now, where you can get an IV and get treatment and try to keep you out of the hospital in an attempt to keep costs down and still give appropriate high quality care. Well, as the community evolves and healthcare services evolve, we need to evolve with it. At the same time, we need to look at where people are struggling, where access is important, because not everyone maybe has the same transportation, and to meet those needs, you've got to build care close to home.
Well, we have this little building going up on 615. For those of you who haven't seen it, for all the right reasons that were just expressed. I mean, first of all, our university hospital buildings are 75 years plus old. And so they don't support the team medicine, the team science that really occurs in the best healthcare delivery systems across America. So having architecture that supports those aspirations is critically important, but also to stay ahead of the growth here. I mean, we're mindful of the kind of growth that's occurring across Central Ohio. We want to make sure that we have enough capacity to grow. And so staying ahead of that capacity, growing in a very purposeful way, thinking about what facilities we need as a group collectively and where those need to be located is critically important. But it's also important that we have modern facilities that can really put the best care is now provided by these teams that coalesce around patients and families. That takes purposeful building of architecture, and all of us are doing those types of things. And also collaboration around things that we share. Tim and I have both invested in the new Proton Center, which is an amazing resource for treatment of cancer patients, both pediatric and adults. So we didn't do that separately. We came together to talk about what does this community need? How could we do that together and use that resource for all of us so that we have a reason for people to stay and have their cancer treated here in Columbus. That's much more convenient for patients and families than having to drive for regular treatments throughout what could be a very prolonged course of therapy. So a lot of this building is to keep up with the growth, but a lot of it is making sure that we as systems have the very vanguard of healthcare delivery.
I think it's been well said. Just, we never build buildings just to build buildings. It's all about the programming, about building access, about building new capabilities. It's not on the clinical side, but also on the research side as we can continue to build our capabilities and finding new cures and treatments. We really need to make those kinds of investments. And these are long 50-year plus types of investments that we're making that are going to benefit the community for long term.
Thank you. It's CMC's longstanding tradition to take audience questions. We'll move to questions from our live stream and in-person audiences in just a few minutes. If you have a question, please make your way over to the microphone now. If you're watching online, please type your questions into the chat. But for the group, for a last question from me, uncertainty. As we enter a new year with a new presidential administration and potential changes in healthcare programs like Medicare and Medicaid, how do you lead your teams through uncertainty? Can you share your personal leadership styles and strategies for navigating these changes?
It is a time of uncertainty. You may not know that 60% healthcare in the United States is a $1.5 trillion business. Obviously, hospitals and our part of it is only a piece of that. And the government pays for about 60% of every healthcare encounter that we have. So as we have a new administration and perhaps new policy and new thoughts, it does create there's risk. And there is uncertainty. As my particular leadership style is to make sure we're always coming from a position of whatever happens, whatever curveball gets thrown at us, we're going to put the patient first. We're going to do what's right. We're going to work with our physicians and work with our associates to make sure that the people of every community we serve gets the care they need. And we believe we're in a great position to be able to do that with our culture, with our infrastructure, our physicians, and our history of financial stewardship. But it does run the risk of being a little different when Dr. Oz is going to run Medicare and Mr. Kennedy is going to run the Health and Human Services. I think we need to talk. I think we need to be very, very active in our listening as to where the trends seem to be going, and I think we need to have strong advocacy. So that we need to make sure that our legislative bodies understand the issues. In some cases, you talk about Medicare and Medicaid; those are razor-thin margins, if any. Often those patients run in the red for a healthcare system. So we just need to make sure we come through with confidence. We put the patient first. We communicate like crazy and listen a lot.
Yeah, I think I would say the same thing, that we start with the patient at the center. What I I really believe in being open and honest and saying, here's what we know, here's what we don't. This scares me too, but you know what? I know we have a great team of people who are committed to making sure that we can continue to care for the patients, and always just making sure that we have the confidence, like you said, that we're confident that we're going to move forward. I always think about the fact that all these changes always seem really big, but this has been happening for years, right? And everybody felt like whatever the change was going to be something either we couldn't do or people didn't understand, and there's also been positive change. So I just think that, making sure people understand that change is a constant. And we know that we've been around, all of us have been around here for many years. We're going to be around here for many years, and we're going to take care of our patients. And I think sharing that message and then working with our colleagues and our leaders to really make sure that they understand that we're committed and that we're going to work together, and that none of us is as smart as all of us. So I say that all the time, and that we're going to work together and we'll figure it out. That's my leadership style.
55% of the kids that we see are on Medicaid. Our funding for our research institute for the National Institute of Health and Department of Defense, graduate medical education, so it's a really big deal, and kids don't vote. So regardless of the administration, we are always actively advocating for children and making sure they're not somehow lost in the equation, and that it's always a great investment. We also look at it as how do we create value, whether it's our accountable care organization or our focus on quality and safety, and making sure that they know we're working to be part of the solution as we advocate for the benefits of kids.
Yeah, I couldn't agree more. Starting next month, I'll start my 13th year as a health system CEO. And so this will be my 4th administration to be part of. And I can think of a lot of really great things that occurred across all 4 of those. This is an exciting time in healthcare. So the short answer is I think optimism helps when there's a lot of uncertainty, and to remind yourself that we're in this incredible time of innovation and discovery for things that were once thought untreatable or uncurable. And so now we see this great advances. So I would say, no matter who's in charge, quality and safety and service always win, because the high quality outcomes that we provide, making sure that the experience of patients and families as they receive those outcomes are critically important. And so if we focus on those things, there'll be some sort of different changes and turbulence in the way that healthcare is delivered and reimbursed. But typically, if you stick to those things, you do pretty well. So I'm always optimistic, mainly because so much change and healthcare improvements occurring. So if we can continue to focus on those, I think that helps. And from a leadership style, just to focus on what we can control, and the fact that from for all of our tenures, there's been a lot of great change, particularly in the last 5 or 6 years.
Thank you. Well, thank you, panelists. And now Doug Buchanan with CMC is curating questions from our live stream audience. For those of you here with us in person, please join Doug over at the microphone. Doug, what is our first question?
Greg, thank you very much, and thank you so much to today's extraordinary panelists. We're so grateful that all of you are here with us today. Thank you. Great questions at CMC always have those 2 things in common, right? They take less than 30 seconds to ask, and what punctuation mark does a question end with? It ends with a question mark. Thank you, everybody. We'll try to get to as many questions as we can. There are a lot coming in online. I'll start with this one. Carrie Gose with Columbus Business First asks, my big question is, are there any business impacts to the hospital systems from the new administration, and we've kind of touched on this, such as reimbursement or impact to all of the major construction projects?
As a couple of us have said, I don't think we know yet. Clearly, given the deficits that the government's struggling with, they're going to have to look at how we get paid. In some cases, there are a variety of programs. I don't want to go into the weeds of drug reimbursement programs and things like that. But I think everything the government's going to look at a lot of things. I'm not aware of anything in the construction side of it that would preclude us continuing to meet the needs of patients or finish the projects that we have. I don't know, John, anything on?
I couldn't agree more. right now it's speculation, I think, for all of us, because we've not seen granularity around some of the priorities of the administration. But for all of us, I think, the construction projects that we are involved with are about meeting growth and meeting patient and family needs. And we're all far enough along in many of these things that I think we're not anticipating any disruption to that.
Hi, my name is Courtney Thrain. I'm the Director of Sector Partnerships at Aspire, and I facilitate the Healthcare Career Collaborative of Central Ohio. And just a quick PSA before my question. I've been working directly with 400 of your personnel to put on the Central Ohio Healthcare Summit on February 19th and 20th at the Ohio Expo Center. And the great news for all of you today is that if you're having a blast now, you're going to be blown away by the 30 hands-on activities that you're all invited to from 2 to 4 p.m. on those days. And those activities include from OhioHealth, for instance, they'll be doing ventilation activities with pig lungs. Mount Carmel is leading up our medical assisting group, helping students from over 50 schools, 2,000 students, to take vitals and learn all about that field. OSU Wexner Medical Center is heading up the surge tech area where you can come yourself and do surgery on an orange. Nationwide Children's, aside from bringing your baby simulator, I'm going to get to my question in like 2 seconds, but Nationwide Children's will have a baby simulator, and you can actually extract DNA from strawberries too. So my question for all of you is that we do partner with the Central Ohio Hospital Council, and aside from your efforts on workforce development, how are you assisting the faculty needs that we have as well that go part and parcel with that?
So it is a team sport, I think, workforce development. So for all of us, I think, I'll speak for Ohio State. It isn't just across the medical center, it's across the whole Ohio State University ecosystem, really thinking about, it's not just workforce needs in healthcare, but it's also workforce needs in technology, engineering, all these different innovation areas. So making sure we're understanding what the opportunities are across the region, and then tailoring a lot of the programmatic offerings that we have across our educational platforms to make sure we're growing those programs that this region needs. So this is a topic of active conversation regularly across, just really thinking about all these businesses are coming. What are they going to need from us, and making sure we're staying ahead of that in terms of programmatic differentiations to not only attract the best students to be part of that, but also to recruit and retain the best faculty and to provide the resources for those students to succeed.
Thank you, everyone. I don't have a name for this question, but the question is, are your hospitals actively planning to improve the support and inclusion of doulas in all births, including surgical births?
I'll let the birthing hospitals take that one.
That's a clinical question. I'm just not close enough. It's in the women's health space. I'm just not close enough to it to answer it for OhioHealth.
Yeah, I was going to say the same thing. I don't want to take that answer or give you the wrong information.
I wish I had my chair over here.
Hello, I'm Jeffrey Lemichuk with CareSource, and as I've been listening to your discussion today, one of the things that interests me is healthcare is very unique compared to other industries like manufacturing or technology, where competition and costs lower the services. And then I decided to go to CMS, which stands for Center of Medicare Services, and found out that our healthcare system is currently 17.6% of our GMP, 2023. And then I compared the United States to 9 other high-income countries, and in our outcomes, we finished dead last. So with that in mind, what additional outcomes can you come up with esteemed leadership to lower our costs and improve our outcomes? Because I don't think the two should be mutually exclusive.
Maybe I'll start. We have a very large accountable care organization called Partners for Kids that takes responsibility for 430,000 kids. And so what we really focus on, it's what we focus on since day one, is really how do you keep kids well? How do you keep them out of the hospital if they're asthmatic, how do you keep them out of the emergency department? By compliance, by making sure they get their well visits, by getting vaccinations. And so it's really, you got a cost per service, but you also, how do we reduce the service and keep patients well, all the way extending up to affordable housing, workforce development, addressing the social determinants of health, which is, I think, one of the big differences between the United States and the way some other countries invest in terms of investing in some of those other areas like housing and food insecurity and those types of things.
And I'll just add, I think one of the things that we need to do is to really embrace the total cost of care. And it's a little bit about what you were just talking about, but where providers and hospitals come together to take care of patients and are not paid just for how many they do, but for outcomes. So providing quality outcomes. And, we've been working at this across the United States for a bit. In some markets, it's really taken off. In others, it has not, because it helps align our incentives. And that's what really is going to help drive costs down and also improve outcomes. But, it's a change for how we operate as a country. And so it takes time, but really think that that's part of what we do. Part of what we need to address that.
Maybe I'll just add a couple of comments. I think part of improving the quality of care and lowering the cost of care is really understanding where the greatest opportunities are. As an example, we've been very fortunate at Ohio State and across the Wexner Medical Center in partnership with the public institutions across the state to have a prospective study looking at behavioral health, just to build on the examples that have been said by the other participants, where we're actually trying to study through what's called the State of Ohio Adversity and Resilience Study, things that are causing problems in mental health across our state. And then prospectively following 3,600 people, 1,200 families across the state of Ohio to really understand what the right investments might be as we understand the root causes of behavioral health needs and problems. So looking upstream to really understand that, making sure that we understand what's occurring, what diseases are prevalent, and what factors might influence the health and well-being of patients and families upstream. So the best value is usually when it's kind of shot selection, knowing where you can best put your efforts, best put your investments to really improve that total cost of care that was spoken about. So I think we'll have to do more of that. It's not just sort of treating what you see right in front of you. It's moving upstream to really understand how you prevent some of the healthcare occurrences that are driving these costs and outcomes.
The question that's asked is really the holy grail of questions. I get, and it's very frequent that we talk about this. It is the challenge we face. Does the United States, some folks would say that our healthcare system is not that strong based on the numbers that were just quoted. We have a sick care system. We have the best sick care system in the world. We don't have a safety net hospital in Columbus. You don't need a safety net hospital. Any of us here, any patient that needs anything in healthcare, if you show up, regardless of your ability to pay, we'll take care of you. We'll get you open heart. We'll get you a heart transplant. We'll get you whatever you need. The question is how could we have prevented it so that we didn't have to have the big expense? We don't, as a society and as a system, we don't have a great preventative system. We don't do a great job with obesity. We don't do a great job with alcohol. We don't do a great job with safety. We argue over whether or not we should make people wear seatbelts. Those conversations still happen. All of those, that's the upstream that John's talking about, is that if we can prevent disease, it is much more cost effective than if you have to treat it at the end stage. And that's the challenge that we all face, and we work hard to try to find our role in that, with education and with advice and with prevention and screening, looking for cancer. It breaks my heart when you see a patient that's never had a mammogram that comes in with cancer who missed 20 years of mammograms. That's the kind of thing we can do that really makes that cost-value equation a little bit more equitable.
Thank you all. And we have about 7 minutes left, and we'll try to get to at least maybe 2 or 3 more questions. I'm going to combine 2 very similar questions from our live stream audience. Carol Looper and Jody Shinney ask, there were issues last year with negotiations between hospital systems and major insurance providers. What is being done to protect patients from treatment disruption?
I guess I'll take that one. I think all of us have had similar, but since maybe Tawanda and I were a bit more proximate to some of this, yeah, it's a challenging, these negotiations. First of all, you see in the media the potential disruption, but please know that both the healthcare systems and the insurance company as well are very focused on that. So, the way all of these contracts work is you have to negotiate, and so unfortunately it always seems to go down to the last minute and promotes a lot of anxiety in patients and families, and in reality with all of us in terms of disruption. I would like to see an industry that works a little better about staying ahead of those and trying to get these negotiations done not so close to the deadline. But we are negotiating around all the things that you would suspect and what have been reported on. The cost of care has gone up a lot for all of us, and for us to continue to invest across communities, we have to be reimbursed in ways that we can continue to invest. And the insurance companies feel that same pressure too, because the costs are up for them. So this is all about trying to find that equilibrium around that. But to answer the question in a granular way, I think we need to be having these conversations along the way so that we're not up against all these deadlines, which promote anxiety in our patients and families. That's not good for anyone.
I don't have much to add. It was the same situation. I think, Mount Carmel, both of us were in that situation, and nobody wants to see in all these things, the patient is in the middle, right? And nobody wants to be out of network, and we all want to resolve it. I think we start pretty early, or hopefully do. It seems to get down to the wire, but we do need a better way of doing that. I agree.
Yeah, this happens every 3 years. These negotiations typically happen, and every once in a while, it's in years past, it's broken down at OhioHealth. I've told our team, Ohio State is going to get through this. We're not going to be opportunistic. I've told our team, listen, patients who traditionally consider themselves Ohio State patients are going to show up in our ER. We're going to take care of them, and then we're going to repatriate them when they can with their docs and the system that they're most comfortable with. Well, we can't be opportunistic or take advantage of it. That being said, you might look at us and say we're big. We're big healthcare systems. When you put us up against some of the health payers at the national level, we are dwarfed, and we work really hard to try to have fair negotiations that pay us fairly. We try not to take advantage of these situations, but sometimes it is really tough when you're dealing with companies that are tens and tens and tens of billions of dollars. When you're here in Central Ohio trying to make sure that you got a level playing field, it's tough. If I offended anybody that's a payer in the audience, I'm happy to talk to you afterwards.
Good question. So we have time for one more question.
All right. This is for Mr. Warner. My name is Ben. I'm a nurse at OSU as well. One thing I have noticed is that there are a lot of travelers at work. And I know the hospital is focused on growth. And my question is, for the new hospital opening up in 2026, I heard, how are you going to keep up with staffing? Are you just going to cycle through travelers, or are there any incentives to keep us working?
Question, and thanks for all that you do for all of us at Ohio State. We're starting early. All of us have experienced the same labor stresses and have had to use more traveling nurses, and not just nurses. It's really people that are in that industry in all walks of life that provide care and service across the medical centers. But we would all prefer to have our own employees and to minimize the use of people who are not longitudinally part of our organization. So we're starting early. We're about 13 months away from opening the new tower. We have about 1,300 people to hire, and so trying to get ahead of that. We'd love to have as many of our team members on board working for us 6 months ahead of time, so that we have a chance to get to know each other, to perfect the work, and to really be ready to open this outstanding new facility. So that requires us to try to stay ahead of it, and we're investing in ways to do that. So thank you for the question.
Okay, so I was just going to say, we're opening in the spring or in April, the facility in Dublin, and we have also been very successful in hiring new entrants. So not taking from our other hospitals to come to Dublin. So it's a challenge, but we're working to stay ahead of it. And we, like he said, really want to staff with our own colleagues.
Thank you.
Just hired I think they just started, right, Tristan? Our first cadre of international nurses from England and a few other countries. So we can't just think, as we think about labor and talent, we can't just think about Central Ohio as the pool. It's got to be a national, if not a global pool.
Well, this hour goes so fast, and I always wish we had more time, but it is time to wrap up, and I'm glad now to turn it back over to Susan Merriman for concluding remarks.
Thanks, Greg. And I hope you all found today's session not only informative, but that you have confidence in our healthcare systems in Central Ohio now and in the future. We'd like once again to thank the presenting sponsors of CMC's long-running Optimal Health Series, the OSU Wexner Medical Center, OhioHealth, and Nationwide Children's Hospital. And thank you to the sponsors of today's forum, AstraZeneca, Cardinal Health, Fifth Third Bank, the Healthcare Career Collaborative of Central Ohio, powered by Aspire, Mount Carmel Health System, and CK Construction. We're also grateful to the presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation, our live stream partner, the Columbus Dispatch, and to The View for hosting us. And our very special appreciation to today's panelists, Steve Markovich, Tawana McDonald, Tim Robinson, John Warner, and our host, Greg Moody. Please join us back at the Ellis in Italian Village next Wednesday for Ohio Higher Education Innovates for a New Era, featuring a terrific panel of Central Ohio's higher education leaders. Thank you again, everyone. We couldn't do it without you. Have a great day.